Hey guys, this is Sergey. Today I wanted to talk about surgery when you are scheduled for the elective surgery. What to expect, what to do, what to bring, and who to talk to. And if you need to ask any questions, what questions to ask. You need to get a referral from your primary physician to get to a surgeon. Reason why you're fasting prior to the surgery because you don't want to aspirate or swallow whatever you have in your stomach, and that content can get into your lungs, and basically you're gonna stop breathing, you're gonna get the aspiration pneumonia. Make sure to ask your primary care doctor what medications to stop and what medications to continue taking. What labs do you need to bring? X-rays, lab work, EKG, cardiac clearance. Make sure to bring your ID cards, your insurance card, and other supporting documentation. When you bring in your ID cards and your insurance cards, make sure it is not expired and everything being paid for. It is much nicer if you can bring the printed list of medications to present to nurses and doctors because it is much easier than going through your bag filled up with meds. You may ask questions when you're in pre-operative area, but you should have asked all the questions when you were at the clinic. If you have last minute questions, make sure you ask that before you go into surgery, but your questions should have been answered a while ago. When you're in a pre-operative area, remember that there are going to be more than 10-15 people coming in and asking you the same questions over and over again. Be ready for it. Don't be too mad, don't get upset, because those are safety precautions that nurses, doctors, and other personnel do to make sure you are the right person and you are having the right surgery. You will see medical students, nurses, doctors, X-ray techs, EKG techs, scrub techs, etc. And don't forget to smash the like button. I'll really appreciate that. How many people are in the surgery? A lot. 5, 10, sometimes more than that. Those are staff members that actually are part of the surgery. It's not like there's a visitors or some random people coming in. Your nurses, you have your doctors, you have your X-ray techs, you have your lab techs, respiratory therapists, you have your anesthesia, and a couple more other staff members. On the day of the surgery, make sure to bring the following: books, iPad, cell phone to keep you entertained. If you've been scheduled for the surgery first thing in the morning, you will probably go in first. If you've been scheduled later on, you're probably going to be delayed depending on the complications of the first surgery or length of the first surgery. So if you're scheduled for 12 p.m., the chances are that you're not going in till later. In other words, be ready to wait all day. If you bring in any specific medications to the hospital or to the surgery, make sure you've been cleared with the pharmacist and your doctor, because there are certain medications that aren't available in the hospital. Tell all the personnel about your allergies and your medications. It is important to remember all of your surgeries in the past so you can tell to the staff and personnel. They will ask you about metals in the body, so if you have any piercing or rings that you're unable to remove, make sure you tell them in advance. Leave all your valuables inside the house. Do not bring any cash because it's more difficult when you at the surgery center. You have to fill out a bunch of paperwork, make sure everything's checked off, so it will give you an extra headache. Do not shave prior to surgery because it can cause infection. So usually we highly recommend you not to shave anything, because once you're in the surgery, we'll do the shavings for you. Make sure you tell them if you're smoking, and make sure you tell them if you're drinking more than a few drinks a day. In the pre-op area, you will get a couple IVs placed, usually 2, possibly get some blood drawn. After the surgery, you might find extra lines or arterial line in addition to your IVs that were placed in the preoperative area. I highly recommend to write down the questions that you might have before going into surgery, like a day before, 2 days before, so you can ask anesthesia, doctors, surgeons before you go in. Once you're ready to go to the surgery and you've been cleared, anesthesia will give you some relaxation medication to make you feel more relaxed and more comfortable. Let's say you schedule for 2 hours, and total surgery time is 2 hours. Don't expect to be back in post-operative area in 2 hours, because once you get in a room, it's about 30 to 45 minutes prior to anesthesia and anesthesia time. Once you're done with the surgery, there's another 30 to 45 minutes to get out of the surgery, and then recovery time is about 2 hours, depending on where you go, whether it is recovery or ICU. Before surgery starts, there are preparation time, there's additional lines, there's Foley catheters, there's draping, there's instrumentation, there's other machines that needs to be set before even surgery starts. If you go into ICU, depending on the complexity of the surgery, make sure you tell your family members in advance that you won't be available for a while, which is 2, 3 to 4 hours depending on what's going on. After the surgery, once you're fully awake and the medication is starting to wear off, you might feel some discomfort in your throat, and you also might be a little sore depending on what position you were in. There are chances that you will be in a crappy mood, you're gonna have nausea, possibly vomiting. It is somewhat common. I highly recommend to take medications on time to avoid pain spikes. And if you had any type of nerve block or epidural, make sure you follow those as well, because once that medication will wear out, you will be in severe pain. All right, guys, this is about it for me. So please like, comment, and subscribe. And please let me know if you want to know more details about the surgery and the process of preparation. Thank you.